isn't it dangerous to be overweight and get surgery?
Yeah, because the more overweight you are, the higher your BMI index is, and
Yes.
higher your BMI,
Yes.
the more it messes with your ability to heal, especially if it's an open wound. I
But
mean,
they
I
went
couldn't
ahead
even
and
get,
did this. But they went ahead and did
yeah,
it with you
because
anyway.
I thought the only thing I had to be able to do was be able to bend over enough to do the dilating, and I would be okay. And
Wow.
my doctor agreed with me.
He actually agreed with you.
Yeah,
My
I
God.
showed him that I could bend enough to dilate, and I told him how much I really wanted this, and
Hey everybody, welcome back to the channel. And today I have a really awesome guest. I'm so excited. I really like this person reached out to me and like literally I hooked it up in the same day, which is kind of rare. But before I move forward, I just want to thank you all so much for supporting the channel and liking and subscribing and commenting. And today might be a little bit intense. So I just want to warn you, before we move forward, that some people might be able to handle the conversation, some might not. It could maybe be a little graphic at times. I'm not really sure yet, but if it's not comfortable, it's okay. Just bail out of here. But if it's not, I do appreciate you listening, and I also really appreciate you moving this out to other people who can hear this. That's the whole point of the channel, is to have these amazing, incredible conversations. So with that, I have Aimee. Hello, Aimee. It's nice to see you.
nice to meet you, Pat.
So, why don't you just introduce yourself to everybody, and then we'll get on with the conversation.
Okay, well, I'm Amy. I'm 55 years old. Live here in Houston, and I'm a male to female trans. I just want to say I know I don't have the best voice. I was working on my voice for a long time, and then I had to go into, I had dental problems, and just bad dental hygiene. Just growing up and never
Sure.
really developed all the great habits as far as that goes. And so, I thought dentures would be the way to go, and then I hated them. So, and once I lost all the teeth, all the progress I made on the female voice, it just went in the toilet.
Oh, you know
Um,
what? I had dental problems too. I had to go have all my bottom teeth removed, and had to have all this work done. And that's why, to the kids out there, floss, take care of your teeth. I mean, seriously, I did. I had horrible dental stuff too, and I think we sort of don't really think about those things. And so I feel you, friend. But no, your voice sounds fine. Don't worry about that. How long ago did you transition?
well, I started hormones in 2004.
Okay.
I was actually working in the place I was working at was perfectly fine with me transitioning.
Hmm.
I didn't know they would be because, back then I was still in Oklahoma.
Oh, okay.
And you can imagine Oklahoma is not one of the most welcoming states for, anything considered fringe.
Yeah.
But the uh, the parent company is actually in Singapore, and we had offices in California, in San Francisco, and so I contacted the HR department in California actually for our
Hmm.
for our, for our company, and we had a phone conference with that office and the HR office in Oklahoma where I was living.
Hmm.
And the first thing we had to do was set about, okay, well, how are we going to transition on the job? Because, yeah, the job was familiar with gay and lesbian people, but I was going to be the first transsexual on the job.
Yeah.
And so we had to figure out the bathroom situation and everything else. And I sat at my desk and I just saw the HR department pulling one department at a time into this conference room, telling everybody, all right, we're going to have this going on,
Mm.
and no one's going to get in trouble for using the wrong pronouns or the wrong name because I was started there in 2000, so I've
Oh.
been there for a lot of years already,
Hmm.
and so everybody got used to me, a certain way, and you know, and so we had to set all that up, and we went over the whole bathroom situation, and we came up with a compromise on that. We even came up with a wording on it. Originally it was, I would use I would use the women's restroom in the back of the building,
Hmm.
or unless it was or no, I would use the gender neutral bathroom, which was at the back, unless it was locked because it's only one stall in there.
Hmm.
Um, and if it's locked, I could go use the women's restroom that was right next to it. But I would stay out of the women's restroom that's toward the front for anybody that wasn't comfortable because I didn't want to make anybody uncomfortable. I was trying to join female society and live in female society, not, I was trying to make a spectacle of myself. I just wanted to be comfortable and wanted to be liked and, respected, and so, but we had to change the wording because the way the wording was originally, I feared that, okay, I go back to the back bathroom and the gender neutral one is, there's somebody in there. And because
Hmm.
everybody likes to, go number two in private, And so, so just in case I was locked, I'd have to go to the other one. I didn't want somebody else going to HR and say, well, I checked the gender neutral one and it was not locked. And Aimee was using the women's restroom back there. She's not supposed to use that if the one is locked. So we had to word it so it was my choice which one back there to use. I could use
Hmm.
either that gender neutral one or that women's restroom back there next to it. But I would leave the front women's restroom completely off limits for me. Because
Right.
I wasn't trying to make everybody uncomfortable.
Well,
I was
that's
just
the
trying
way
to
we
make me
used to be.
comfortable.
Right,
Yeah,
that's
I
the
was just,
way we used to be. We cared
yeah,
about other people. Like,
hmm,
I consider you more like a transsexual. I do use different
yeah,
terminology, the old school.
yes,
Like we just want to blend into the world. We don't want to make problems. Like you respect women. You don't have to be calling everybody a transphobe. This is see
hmm,
everybody, this is how it was. We
hmm,
don't want to make problems. We just want to sort of blend in and move forward. It's just disgusting how it's become. The reason you contacted me, your email to me was really caught my eye. I get a lot of emails and a lot of people want to come on my channel. I wish I could bring everybody on, but your email was something very specific. And I really kind of want to jump into that and then we can sort of move back and forth. But I really want to get
okay.
to the crux of the conversation. And so instead of me kind of maybe saying it, why don't you say what the email was that you sent me, and maybe why you sent it?
Well, the last bunch of videos you've been posting have been all the dire warnings about doing any kind of surgery options if you don't have to because it's
Yeah,
so dangerous and so risky. And try to find every other option you can. Save surgery for a last resort where it's
yeah,
just the only thing left that's going to make you feel whole.
yeah.
You know, then, and even then, it's still going to be super dangerous. Just because you're willing to accept it doesn't mean it's not dangerous. And,
Right.
um, the worst possible complication, of course, is death.
Yeah.
And I had what a lot of people were considering to have been the second most worst possible complication because I wanted actual death. I wanted sex, what I considered to be the correct way to have sex for me.
Yeah.
Yeah, I
Right.
could do all kinds of other sex things and stuff like that, but
Sure.
I wanted to have that man woman type sex. That
Yeah, you wanted to have
and
sex like a woman.
yeah, yeah, I
Yeah.
needed that woman part. And
Yeah.
I needed to have some depth and um. I wasn't blessed with very much material to work with. So my surgeon had to do what they call a hybrid method, where it's called a perineal pull through. And what they do is they take your tissue that you do have, and then when they go up and they form, cut the opening and they
Okay.
go up into the perineum. That's all all this that holds your guts up into your stomach. It's all got a perineal
Oh.
lining. And what they do
Oh.
is they go up and they cut into that lining and pull that material down and use that to kind of form this cavern or tunnel all the way
Wait,
out as deep
so
as you.
that's if you don't have enough, like if the length of your penis, right? Because most of the time they take the penis and they invert it and make a tunnel, right?
Yeah,
But if you
that was
don't,
the original way of doing it was by doing that.
and then so this one, they do this particular kind because you don't have enough sort of length? Is that why they do it,
Correct.
or they do it for other?
Correct.
Okay,
Correct.
so there's
And well,
no.
some people, their dysphoria is so intense. Like mine was pretty intense. Like,
Sure.
I didn't even really want any of my male tissue to even be part of my body
Yeah.
if I didn't have to.
Yeah.
But so I asked the doctor, and I asked other people as well that had had the different surgeries, because there's
Hmm.
also the one where, um, I wish I could remember the name of the other
Okay.
type of surgery for doing it, but the other type of surgery, they would actually have to have two different surgeons, the plastic surgeon and a intestinal specialist of some kind, because they
Oh
would
wow.
actually, uh, God, I wish I could remember the name of the other type. But yeah, there's more than just one way of doing the surgery and creating the
Sure.
canal now. And some of the perks, like if all you use is just the penile tissue inverted, you don't, you're going to have problems most of the time with your body creating your own lubrication, self-lubricating.
Right. Right.
And by using some of the lining that they pull down from inside, it's because it's covered in
Oh.
mucus and all that stuff. So it creates its
Oh.
own wetness, your own personal lubrication,
Oh.
when the girl gets wet.
Right. So that's
And
why they kind of go up what you call the hybrid.
yeah,
Um,
the hybrid method.
so they pull that. That's your actual intestinal like lining or
Yeah,
something.
some of the
Wow.
lining, I think they call it perineal
Perineal.
lining.
Okay.
It's been a while
Okay.
since actually, it's been a number of years.
Sure.
Um, but yeah, they cut into that
Mhm.
and use that in conjunction with your own tissue, and they graft all that in together and form the canal. And then the actual depth of your canal really actually has nothing whatsoever to do with penis size. You can have a 32-inch penis, and you're not going to have a 32-inch vagina depth. Your actual depth, you can only go inside the opening until you hit the pelvis. So
That's right.
however high up your pelvis and all the stuff inside you is,
Yeah.
that's as deep as you can go.
That's right. Right.
And that's why that's another reason for calling it a neo vagina, because
That's right.
it doesn't go all the way up into a cervix and all that stuff. It goes up
Yes.
until it's a wall.
Yeah, that's right. So
And
they can only actually make it that particular, and everybody's, so is everybody, every male to female body is different when it comes to that structure.
yeah,
So right. So your pelvis wall could be different from the next person's pelvis wall,
yeah,
right? So
all my innards could be higher, could be lower than somebody else's.
great. Okay.
And that's where the
Great.
real depth of your canal comes
Okay.
from.
Okay, so
And
you're getting this surgery, and how long into your, so you started your transition in 2004. When did you start this surgery?
well, I didn't actually get the surgery until 2020.
20. Okay, so that's like
Yeah,
5 years ago. Okay, no,
yeah,
that's fine. A lot of
because
people don't. Yeah.
I had a long ways to go, because at the time, way back in the beginning in 2004, I was still morbidly obese.
Oh
I was
wow,
at one time in my life,
wow.
but I wore a size 8 extra large when I was
What?
still masquerading as a boy.
Oh
And
wow.
that was one of the cool things that changed. As soon as I went full time at work and everything else, I lost 2 dress sizes in like 3 months. And it's because
Wow.
I was happier. I wasn't trying to kill myself with food anymore.
Of course. Yeah. So you having like an eating disorder to sort of hide your male
Yeah,
body, maybe, right?
yeah,
For
yeah.
sure.
And and that did give me some perks. The bigger I was, the more easier it was to pass as female, because I had the curves.
Oh, I didn't think about
and
that.
and
Right.
it was a little bit hard to pass because of 6'2", so I kind of
Okay.
welcomed in the weight a little bit when the hormones started pushing the weight around in the right areas finally.
Yes, right. That's what it
You
does
know,
for both of
and
us. Same with me. It
yeah,
distributed my fat differently, right? Even though when I was still living as a female, I always had a kind of masculinized body. So
mhm,
my transition, I think, was pretty. I do think the transition, I always say this, is not as difficult from a female to a male as it is from a male to a female. I think there's a much more involved for somebody like yourself than it is necessarily for a
Yeah, they both have
female.
different difficulties.
100%. But I think it
And
just, in my opinion, and being around it, it just seems like the male to female has a lot more kind of things to have to deal with. The masculine. This is why they want to give children puberty blockers, which is
Mhm.
disgusting. But because they don't want to masculinize these young kids, or it's easier to
Yeah,
masculinize than it is to feminize, if that makes sense.
yeah, and I went back and forth on that too, because I always, for a long time, I thought, man, I wish I could have transitioned when I was younger and didn't have
Of
to
course.
have that male
Yeah.
body. I wanted, and but then, from listening to you and seeing all these kids that transitioned early and then are regretting it, so many problems and stuff like that.
Totally
I'm
gross.
back to my original belief of, you shouldn't transition. You don't know you're going to hate your body and have your dysphoria until you got your body, and you don't have your body until you've gone through puberty.
Right on, friend. So I was the same way. I was all about trans kids. And then I started thinking, wait a minute here. These kids don't even know what it means to be a dude or a chick because they're not even
Yeah,
in that space yet. So how do they know that they're trans? It's so here you go. You're living your life. Da, da, da. Like we'll get back into that, but I really want to get into the surgery. And the reason why everybody that I really get into the surgery is because I did a video recently about the female to male penis surgery called phalloplasty and all the
mhm,
complications that come with that. And the trans community doesn't talk about it, and they pretend like it's totally okay. So all these young guys are like getting the surgery and regretting it. And
yeah,
I this is why I'm hated, whatever you want to call it, in the community, because I'm willing to have these conversations. These complications are very bad, and we need to have the conversation. So you're getting this particular, sounds pretty drastic, surgery. Was it?
yeah, yeah. I didn't feel like it was drastic because it was still, I needed it so much for my
That's
own mental
yeah.
sanity.
Sure. Sure.
But uh, but yeah, and as far as the yeah, I got a great catchphrase for you, something I've heard a bunch of times. But
Okay.
as far as the difference between the two different surgeries for going one direction versus going the other one,
Yeah.
the reason the surgery is easier for male to female because it's easier to dig a hole than it is to build a pole.
True. It's actually true. On
And I've
some
always liked
level.
that catchphrase.
On some level, but on some level, but that's not what happened with you, right? Did you
No.
start? So let's talk about. Here you are getting the surgery. How long did the surgery take?
Well, it just took, I think, about 4 to 5 hours to get the surgery done, and
Wow.
then I was in the hospital for 4 days. They
Okay.
take you back to your room,
Right.
and the canal is all packed with gauze and everything to keep it open in the meantime.
Okay.
And then you stay in the hospital, and then you go back into surgery, general anesthesia 4 days later, and remove all the packing and
Oh.
make sure everything is okay. And then
Okay.
on the day they send you home, they teach you how to dilate that day that they're
Right.
sending you home.
Right.
I had a person come in literally 30 minutes before I was getting ready to release, and they took the dilators and told me, okay, this is how you do it, kind of go in and kind of go up. Like,
Yeah.
stay here while I figure this out, please. And no, they freaking didn't do it at all.
Wow. They
Um,
just like told you just put it in and put it out. Like
yeah,
not no. Wow.
yeah.
Just wow.
And so I'm at home recovering for a few days, and I go back for my initial follow up a few days later, and the doctor, the surgeon sees that, because I was still having a lot of pain, and I
Hmm.
just thought it was because the pain would eventually go away. I was dilating like I was supposed to be, and everything else.
Hmm.
But the doctor, he didn't really tell me. He said it was. He said he needed me to go ahead and go across the street and get readmitted. So they didn't even send me to the admissions place or give me a wheelchair to get across. I walked,
Wow.
across a 6 lane and train highway to get over to
Wow.
the other side of the hospital to the admissions. And then, I was telling the admissions lady, I don't know, you just told me I need to come over here and get readmitted.
Wow.
And, um, but yeah, I could barely walk because what was going on was I told you I had to bring down the skin and graft it to my outer skin and all that stuff. And it turned out that grafting didn't take.
Oh,
When you graft skin on the skin,
yes.
that skin needs to get blood flow, all the way up to the very outermost layer of your skin. There's blood vessels in there. And, that's why you can just barely nick your skin and it'll bleed.
Okay.
And, what happened was that the graft he had created to create my canal didn't get vascularized good enough. And I don't know if it's because if there was a problem with the surgery or if I had done something wrong
Oh,
and or what happened exactly. But my canal was decaying and dying and turning into a black, sick, disgusting, infected mess. And I, anybody who, I mean, basically you've seen people get gangrene and stuff, and this was the kind of stuff that it's just going to spread and spread and spread and spread and spread. And
and kill you because you could get
yeah,
septic
my body
from
was
that.
filling with toxins, yeah, and you get septic. And once I got admitted, um, then became the next 2 months of living utter hell for me. Um,
Wow.
what they had to do was put me under general anesthesia, completely knock me out every other day. And they would, while I was knocked out, they would go in and they would cut away as much of the decayed flesh as they could, I, safely. I guess they couldn't just cut it all away at once. I don't know why they couldn't do it all at once. I
Well,
don't
probably it
know.
would collapse. Something might collapse or like, yeah. Oh
But
my
yeah,
God.
I was in the hospital for 2 months, and for about the first 2.5 weeks of that 2 months, every other day I was going under general anesthesia, getting cut away a little bit,
Oh my God.
and they take me back to my room, and the dressing that they had to put on me, it was a wet dressing, you know, um, it's some kind of like a biomedic gel,
Yeah.
and they would lay that on my exposed raw tissue. And at first, for a while, they had a catheter in, so it wasn't a problem going to the bathroom. But then when they thought they got far enough along, and they didn't bother to recatheterize me while I was still staying in there anymore, and because I was able to get up and walk, with a lot of pain, and so I could make it to the bathroom. And when I would go in there and sit down to use the bathroom, I don't know if you've ever felt that kind of pain, urinating on raw, open, exposed flesh, where I, I was on the most, it was like somebody had taken hot pokers and was shoving them all against my skin,
Oh
all the
my
way up inside me.
God. Oh my God.
And nurses had to bring a basin of water that they could suck up into a syringe, and they was squirting the syringe of water on my vagina as the
Peeing.
urine was coming out,
Yeah.
so that it wouldn't get on that skin.
Oh my
And
God.
after 2 days of that, they decided to go ahead and redo the catheter again.
So they had you
And
suffering there for days without, why didn't they
yeah,
just reinsert the catheter?
I don't know why. And maybe I wasn't the best at self-advocating at the time. By that
Yeah.
time, I'd been in so much depression in there because I
Oh my
couldn't get out of the
God.
hospital or anything like
Two
that.
months? 2 months you were in that hospital?
Yeah, and
That's insane.
then they have the priest people in the hospital that go around, when they say, "Would you like somebody from the chaplain service?" That chaplain service. And one night I was so depressed, I wanted to find a way to break the window in the hospital and just jump out
Oh my God.
and then everything. And um, so I reached out and said to the nurse and asked for somebody in the chaplain service to come see me. Nobody at all came that night. And 2 days later, finally somebody from the chaplain service came because they saw that I had reached out and wanted to come and see how things went. And I told her, and she was supposed to be the one that's in charge of the people that worked at the chaplain service even. And she was generally apologized for how that went and everything. But then two more times while I was there, I tried to get Chaplain Services to come and sit with me in the middle of the night because of the depression it was causing from being in
Yeah.
there and all that stuff was going through. And so, yeah, 3 out of 3 times that I tried to ask for that, none of them showed up. And so I've got a real hatred for, religious groups right now.
Well, that's not true Christians or whoever was. That's
Yeah.
not they should be ashamed of themselves. And I have a lot of Christian people who follow my channel for some reason. I don't know why, but they do. And true Christians would be appalled. They will be appalled at this. They will be
Yeah.
mad about it. They did that because you're a transsexual. I think that they felt like they
I
were
think that's why too. I mean, they
yeah.
would never admit it, of course, but
Never, never. And wait, what state were you in? Could you say it? Did you tell me that? Or
yeah, I'm in Houston,
you?
Texas.
But during the surgery, this was Texas
Yeah,
as well.
yeah,
Houston.
and it's
Yeah,
Houston. So Houston's one of the blue areas. Houston and Austin are kind of the blue
I
areas,
I know. I'm
and
shocked.
there is an incredible trans community here in Houston,
I
actually, and
know.
that is the one blessing. Every single day, somebody from my trans community was there visiting me during the day, at least.
Wow. So that's community. That is what I
Mhm.
have to say. That is what community is, and not what you see
Yeah,
this weird shit happening today. But that's really what's community. You're supposed to be. We're supposed to be helping you go through this insanity. Was this
yeah.
doctor that you used? Was he somebody that was already versed in creating these
Yeah,
vaginas?
and
Oh,
I got him as a referral from somebody else who sang his praises. I don't mind saying his
see,
name. Am I allowed to say his
you
name?
can say his name. I don't.
Okay,
Why not?
okay,
He's your
yeah,
surgeon. Why not?
yeah. Dr. Daniel Freet from UT Physicians on Fannin Street.
How do you spell his last name? Fr?
Uh, Freet.
Yeah, I'm gonna look him up. Daniel Freet. Okay. Wow. So no, you can 100% say his name. He's literally your doctor. So as
Yeah.
this is happening to you, is Doctor Freet coming in to visit you or saying anything to you during this time?
He might have made an appearance sometimes, but I, I think 98% of the time I was passed off on his staff members to do the surgeries and everything else every other day.
Oh my God. You know how many times
Um,
I hear this, Aimee? And this happens, especially in the trans male community when their penis surgery goes bad. The doctor doesn't want to have anything to do with you anymore because this is what they were telling me, these guys, because it looks bad on the doctor. So they try to
mhm.
disassociate themselves with you because they don't
Yeah,
want people to know that this surgery did not work. But it's so important that we say who this doctor is. And it's so important that we understand this situation because is he doing these same kind of surgeries on other people?
yeah,
Do you
I've
think
got at least two friends that have had surgery with him. Another person, the one that actually referred me to him,
what?
she was going to him for a revision actually because she didn't stick with her dilating, so she lost her depth and she was going to have to go get a revision to get her depth put back,
Oh my
basically.
god. Oh my god.
And
It's but has anyone ever had the same problem that you had? Do you know of anybody who had the surgery done who has the same situation that
I've
happened?
never heard of anybody having their vagina die, basically. And that's what mine
Basically,
did.
so
And
so
I'm still dealing with it because
yeah.
since I don't, they took, um, they had to give me new skin down there, and so they took skin graft off my thigh,
Oh my
about
god.
two 6 inch by 3 inch strips off my thigh, is what
Mhm.
it took to fix that down there. And
Mhm.
that wasn't to give me any depth. That was just to patch the skin. Basically, I lost the entire canal. Right now, my vaginal canal is as big around diameter as my ring finger. I can shove my ring finger up in there if I try real hard and use a lot of lube, and it only goes up to about the second knuckle.
So what this
Now,
is
the
so
one
so that's
blessing I
kind of
have
like
is that, uh,
called vagioplasty, right? Vagioplasty is
yeah,
different than what because
yeah, it's
vagioplasty
basically a
is
zero depth.
zero. Is I always call it the Barbie bump. So it's just
Yeah,
basically sort of like a cosmetic vagina that's
yeah,
not
I've
functioning.
basically got I got a functioning pee hole. and I've got a functioning clitoris actually, at least. So at
Oh,
least
wow.
I can successfully get orgasm.
Wow.
It's just not through any kind of penetrational stuff. Now I've found ways,
Wow.
I found a dilator that is that small enough diameter
Small.
finally.
Sure. Sure.
And if you take a dilator and put it in there, and then you put, adult toys against the base of that
Sure.
dilator, it's kind of like a
So you
makeshift
have,
vibrator.
right. So you do have some actual feeling. You didn't lose.
Yeah, yeah,
Uh,
nerves are still down there.
wow.
I can, just as far as that, that fantasy of that, awesome boy girl sex, like,
Mm-hmm.
yeah,
Mm-hmm.
that's that's
Mm-hmm.
never going to be a case. I mean, yeah, I could go and I could go somewhere else and get a revision, but
Don't do it.
I'm dealing with so many other things right now, and at least I can pee correctly. And there's so many people that can't even pee correctly after surgery, and
What?
um, I don't have the best urine control. Um, Even all these years afterwards, I still wear a overnight incontinence pad in my underwear all day long, all night long, because if I don't, then they say as a woman gets older, they sneeze and they pee a little bit. Well,
Yeah.
I basically have had that since the beginning at this point,
Because it literally took
and
away your whatever functioning of your of holding your pee, so it
yeah.
destroyed that for you. So how long? So here you are, you're 2 months in the hospital, you're going through so much pain. Are they giving you pain? They must be giving you painkillers.
Yeah, they gave me pain meds and stuff. Um, Not as good as I got for the one with the problem that I'm dealing with now, but
Right, which we'll
um,
get into. So there you are, and then it takes 2 months there. Then they have to they had to replace the skin. How long did all of this take?
well, the surgery originally was on December 30th date, and
Okay,
then my follow-up was January 4th, and then they sent me right back over across the street on that same January 4th to get readmitted,
yeah,
and then I got out about the last day, February the next month. So yeah.
and
Two
then
months, give or take a day or two.
2 months of the whole like situation. And after you
Yeah.
got out of the hospital, how did you feel? I mean, physically, we'll get into mental next, but physically, did you feel like you could pee and do the functioning again? And
Yeah, I was able to pee and everything else normal. I just couldn't hold my urine. So basically, I had to get rid of all the cool, sexy thongs and stuff like that. No more sexy underwear for me. Because I had to have
so
underwear
sad.
that would cater to having to have one of those overnight
Like adult
pads.
diaper, like an adult diaper or adult undergarment
Well, I
thing.
started off, I did have to do diapers for a while.
Yeah,
The pull-ups.
yeah.
And eventually, as more and more healing went on, it took about a year and a half before I didn't have to buy any more pull-ups, and I just had to buy the pads to put inside my underwear.
Oh, I see. Right. Yeah.
And
Right.
presently, I can put a pad in the morning, and it'll last me, and I may not even have to change it before I go to bed, although I do because that would be gross. That's kind of like not changing your underwear each day,
Totally.
you know.
Yeah, this is true.
So
But okay, so let's
I
get into
mean,
your mental
yeah.
health. How did it take a toll on your mental health?
Oh, absolutely. Because I mean, I couldn't really dilate because I didn't. I had to search forever to find any kind of dilators that would even go in that small of an
Wow.
opening.
Yeah, because you still have to dilate, even though it's tiny. If you don't
Yeah,
dilate, it just completely closes back up again, right?
yeah.
Right.
And so yeah, I've gotten to the point now where I don't really bother dilating anymore because it's not going to make it any deeper or any wider because you know for a while I worked really hard at it and I can move it maybe a millimeter to the left and right once it got
Sure.
inserted
Sure.
before it was hitting you know hard structure, the bone or whatever just down there.
Uh-huh.
And
Yeah.
so the only way to make it better at this point would be if they go in there somehow and cut into the bone and create for that
Oh,
the skeletal opening figure itself.
oh my God.
And I got too many other things going on to even bother with that.
Also, I don't even know, in my opinion, but it's, everyone's dysphoria is different. Like, I just can't,
Mm,
after all that traumatic, like, to even take another chance on it, it just would be
mm,
like, but I want people to understand, however you're feeling about her conversation with me and whatever judgment you might be making, because you probably are, you have to understand that the dysphoria is so intense for many of us that, especially the bottom spot, that people are willing to go through this kind of stuff just to be
mm.
able to not have the genitals we're born with. And so I hope you can put your judgment aside today and you can just sort of listen to the story in a compassionate manner and also understand that Aimee didn't deserve this. Aimee did not deserve to have this shitty surgery, nor go through all this shit and not have anybody show up and just be put through hell. Because why did this happen, do you think?
Uh, I'm assuming, because maybe the age when I got it done, I was already pretty old, and I was
Mm.
still, you know, probably right at around, you know, three, 300 something pounds.
Oh,
So
you
I
were
was, I
still
probably,
heavy. You were still heavy
yeah,
when you had
I
this.
was down to
Oh,
wearing maybe a 3 to 4X in size.
oh wow. Maybe you're
So I'm
right.
assuming a lot of it was just my own poor health.
But the fact that they went ahead and did the surgery anyway, because
Yeah,
let me just
because
say, they should, because what I remember when I had my top surgery, right, which is nowhere near what's happening there, but I remember you weren't allowed to be overweight. The doctor, you can't smoke, you
yeah.
can't drink, you can't be heavy. And they made a very, this was 30 years ago. They were like very adamant to move forward today, especially in the male to female to male space. I see a lot of these young kids are heavy, if not
Mhm.
obese on some level, and they're all getting their top surgery. I'm thinking, I thought it's dangerous. Isn't it dangerous to be overweight and get surgery?
Yeah, because the more overweight you are, the higher your BMI index is, and
Yes,
higher your BMI, the
yes.
the more it messes with your ability to heal, especially if it's an open wound. I
But
mean,
they
I
went
couldn't even
ahead and
get,
did this. But they went ahead and did
yeah,
it with you
because
anyway.
I thought the only thing I had to be able to do was be able to bend over enough to do the dilating, and I would be okay. And
Wow.
my doctor agreed with me.
He actually agreed with you.
Yeah,
My
I
God.
showed him that I could bend enough to dilate, and I told him how much I really wanted this, and
Wow.
I had the clearance from 3 different psychiatrists
That's my
as well as the
question.
doctor because I had to have all those letters to send to the insurance company before they would pay for anything.
Before insurance. So you did, so your insurance company, but this is 2004. Oh no, this is
Mhm.
2000. Yeah, right. You got your
Yeah,
surgery in 2004. Wait, when did you get your surgery?
no,
Two,
in
5 years
2000,
ago?
about
2020?
yeah, 3 to 5 years ago. Yeah,
Yeah.
it was
So,
before COVID happened.
okay, right. Before COVID. So you had to actually go to therapy and you had to get a letter and it had to be sent to your,
Mhm.
but even the doctor, or was that strictly for insurance? Or does the doctor want those letters as well?
The doctor wanted them because he had to use them to submit to the insurance to get the insurance to pay for anything.
I'm wondering if insurance was taken out of the equation, would they do the surgery if you were paying just out of your pocket as an
Oh,
adult?
absolutely. Yeah.
They would do it without
Um,
any therapist.
yeah. I think a reputable one would require at least a psych letter.
I think, well, of
Um,
course, yeah, I think totally. But we don't have a lot. It's a lot. Well, I don't know about a lot, but we have very like sketchy doctors who are just kind of
mhm,
getting in on the gender affirming
mhm.
surgery spaces.
Yeah.
So here you are doing that. I didn't realize that you were actually obese, and they told. Is that obese? Would you consider that obese or just overweight?
I would, and make people would, and everything goes. I mean, yeah, I was 6'2", so
Mm,
I carried it a lot better. And maybe that's what helped. And
hmm.
by that point, I was riding my bike and everything, and I could bicycle 45 miles a day from like 5 a.m. to 11 a.m. because
Wow.
that's another thing I was doing was I was doing that to do food delivery on my bicycle downtown.
Wow.
And
That's
when
a
I
lot.
started that, I didn't have an e-bike or anything in the beginning. I had a normal, personal powered bicycle
Yeah.
that I pedaled with my own power. And
A
I was
real
going up
bike.
and down streets in downtown Houston all morning
Wow.
long, from
Wow.
Starbucks to the jail, Starbucks to the sheriff company, Starbucks to all the different high-rise buildings. And I was getting 40, 45 miles a day. I actually, I surprised my weight loss surgeon one time because I took my bicycle and I rode it all the way from home here in Houston all the way to Sugar Land.
How far is
Just,
that?
well, it took me about 3 hours because, I wasn't going,
Wow.
I didn't do it quickly or anything. But yeah, Houston to Sugar Land is just, you got
So
Houston, you got Missouri City, and then you got Sugar Land.
so
It's
you
just
went
all
to
kind
a
of one suburbs are run all together.
yeah, right. So you went to a weight loss surge doctor who helped you lose the
Yeah,
weight?
yeah, a long time ago.
Oh, okay.
And
Okay.
he's what helped me get the weight off and stuff. And then because I had to do that before I could get the knee surgery I needed. Because I
Okay.
also had to have I had left knee problems all the time
That's
because I was
from the
overweight for so
weight.
long. Yeah,
That's from the
and
weight. Yeah.
so I got a left total knee replacement, which I healed up real quick from that because I busted ass on physical therapy on that knee.
Right on.
You know,
Right
he
on.
the knee surgeon told me I was about 12 weeks ahead of where he thought I should have been already. I was
Wow.
I was back on my bicycle and earning money,
Good for you.
and plus I found a good bicycle community here in town too, and so
Great.
we'd have bicycle riding events and stuff like that. Um,
So do you have
and
any more complications with your surgery at all, or is it all done? It's like just
Yeah, the surgery's all done, unless I just want to get more depth or width, and that'd be the only thing that could happen. And then other than that, it's just the having to wear that overnight pad all the time.
yeah, that's right. Yeah.
Um,
So when I was talking to you on your email, you said that you had got diagnosed with cancer.
yeah, last November, shortly before Thanksgiving, during all the holidays, when none of the surgeons wanted to do any surgeries during any of the holidays, but
Sure.
um, I had one of the surgeries I had related to the weight loss. I had a lot of loose, sagging skin after I
Uh
lost a lot
huh.
of weight, and so we had
Uh
done a
huh.
panniculectomy where they basically take that flab of stomach all the way around from your stomach all the way around all the way around and back to the spine, and it cuts you a
Oh,
360 all the way around,
what?
and take out a bunch and then pull some skin up, pull some skin down, and give you a nice flat tummy and a new belly button. And that ended up getting a seroma inside,
Oh no.
and it was just like a pocket of fluid. And so we had gotten surgery finally to get that cleaned out, and that was with the same plastic surgeon, Dr. Freet.
Oh no way.
And um, he cleaned out the seroma, and after he had done the panniculectomy, about a year later after doing the panniculectomy, he got into surgery with him to get the seroma cleaned out and everything, and that ended up getting infected. I've noticed that every time Dr. Freet sends me home without sending me home with a prescription for antibiotics, I got an infection every single time.
Well, why wouldn't you take
And
antibiotics after a surgery? Aren't you supposed to? Isn't that?
they, well, they flush out the whole area with antibiotics. They put you on antibiotics while you're in the hospital, and they think that's good
Yeah.
enough. And the
Wow.
two times that he didn't send me home with antibiotics was the two times I got infected from his
That you
surgery.
got infected. Wow. The second time.
And so anyway, they got that cleaned out, and but um, when it got infected, I was running 103-degree fever, so I went to the ER to go get checked out and everything, and they did a CT scan, and during that CT scan, and then they ambulanced me over to the hospital after that ER trip. Um, that's when somebody from the oncology or urinary department, somebody came from a different department of the hospital to tell me about the masses they found on my right kidney and my lower spine.
Oh my God.
And
What?
they were 6 centimeter masses, and since it had already spread from one to another thing, that's what makes a stage 4 is if it's already spreading from one thing to
Right.
another thing.
Right. Oh
And
wow.
I've had the surgeries to get all that taken out, and but since it's already spread, that means I'm still stage 4. It's still gonna spread more. It's just nothing else in there right now is big enough to be detected. But I was recently having a bunch of headaches and stuff, and so I had an MRI of the brain, and that came out okay from what I can tell
Mm-hmm.
from Googling the big words that were in the results.
Mm-hmm.
When they did the CT scan of the chest, abdomen, and pelvis a couple days later to go with that, um, there was mentions of nodules in certain lobes of my lungs. So I've got to find out what that's all about now because
Oh
I
my
looked up
God.
the type of nodules that it was listed as,
Yeah.
and Google, of course, take Google with a grain of salt, of course, and you get information from the doctors, of course.
Of course.
I'm not saying diagnose yourself, but anyway, it said it can be benign or it can be cancerous, and I'm like,
Uh,
well, considering I've got stage 4 cancer, it's probably
yeah.
not benign.
Wow.
Um,
Wow. I'm
but
so
at least it's not in the
sorry.
brain yet. But originally, when I saw the oncologist for the first time last year,
Yeah.
um, she gave me a 3 to 5 year prognosis with treatment. And
Oh
right
wow.
now, I'm not having to take chemo. I'm taking what they call immunotherapy, which is more targeted with a chemical called Keytruda.
Mm-hmm.
But there's the possible chance that that could basically create an immune deficiency because
Oh my God.
basically they take the stuff to try to make your own immune system kick into gear super hardcore, but they can make it do it so much that your immune system goes into overdrive and you basically end up having the same effects as AIDS.
Oh my God.
Your immune system kills yourself. Hopefully, I don't get that effect.
Oh my
I'd like
God.
one thing with this. I'd like one thing with my body and the surgeries to come out, on the good side for a change.
I know it seems like
And
since you got
basically,
the surgery, it's just been hell.
yeah. But
I'm so
if I hadn't
sorry.
lost weight and then got the weight loss surgery, which I did, I lost a lot of weight before I got the surgery.
Yeah.
I didn't get the surgery until I basically stalled, and by then I had already got my diabetes under control on my own,
Mm-hmm.
and um, I just needed that last thing to kind of kick more weight loss in the butt and get it kicked into the next year, basically. And so I lost a bunch of weight. When I had my weight loss surgery, when he put me on the 2 week liquid pre-op diet,
Yeah.
um, I was at 450, and that 2 week liquid pre-op brought me down to 425 the day of my weight loss surgery. So I was already
Wow.
down to 425 on my own
Wow.
before the gastric bypass. And I had a complete gastric bypass, the one they call a Roux en Y, where they
Yeah.
actually cut out this a portion of the lean and create a whole new stomach pouch.
Yeah.
Which from that you can take I can't take NSAIDs now because NSAIDs they'll go into the new stomach pouch and cause an ulcer. So I can't take Aleve, ibuprofen, Motrin, any kind of all those muscle relaxers
Can you
that you're
take
so used to
Tylenol?
taking. Yeah, Tylenol is the only thing I can take.
It's the only thing.
Even Pepto-Bismol is an NSAID.
Oh, so wow, you can't have any of that because of that. But so
Yeah,
it just made your stomach smaller so that you just eat less, and then that's how you lose
yeah,
weight, right?
yeah, and
And how much weight did you
basically right
lose?
now. I am down to, let's see, before I started getting the cancer, I was down to maybe 350,
Wow.
and it has stayed going steadily down.
Wow.
Initially it dropped a bunch fast, and then it slowed down, and it would, yo-yo a little bit here and there and
Sure.
stuff. And my weight loss surgeon, Dr. Rizwan Chaudhry, don't ask me how to spell it, Chaudry, and how you spell Rizwan. And oh my God, he is a sexy beast. He is this by far this super sexy doctor.
Yeah, but he's also seems like he knows what he's doing.
Yeah, and um, I didn't have any problems from that surgery at least, and it allowed me to get the next surgery I needed, next surgery I needed, and next surgery I needed, so that I could finally get the gender surgeries that I needed. The first surgery I got for my gender stuff was I got the breast implants,
Yeah.
which was one of the other things that got infected. And
What?
he put the implants in, and he was going to come back a couple months later to do the lift and the more cosmetic part of it
Yeah.
all. And so when I went for that surgery to do that part, I woke up and he said, well, when he went in, he found infection in the left one and had to take that one out and went and took out the right one for symmetry. It's
Yeah.
like, why the fuck did you not wake me up? I would not have let you, I would have
Well,
been
they
fine
had
with one
to.
damn breast,
Really?
and yeah, because at least I would have had one, and I didn't think insurance was going to pay for another set of breast implants. I couldn't
Well,
afford stuff on
if
my
you're
own.
if you have an infection, they probably pay for it because
Yeah,
it was an infection. It wasn't your fault,
yeah,
but
and
that's
they did.
crazy.
I got the next breast implant surgery on December 30th. Yeah, the first one was in June, and then they tried to redo it in July to do the rest of it, and then
Yeah.
it got infected, and then I got more approval letters and everything else for another surgery and got it done on December 30th. And I seem to have a thing with December 30th gender surgery stuff.
How
And
about how does your family are you in contact
yeah,
with your family? With your mother?
I'm in contact with my baby sister. I'm the
Yeah.
oldest of all four children. I'm in
Yeah.
contact with my baby sister. And I've gone back to see her a time or two in Oklahoma.
Yeah.
She came up here one time. She's got a lot of problems she's dealing with,
Yeah.
and I finally reconnected with my baby brother in San Antonio, and that was going great for a few years.
Yeah.
He didn't agree with it. He's very,
All right.
Bible, God doesn't make mistakes, that old saying.
Sure.
And but he didn't throw it at me. So about 1 week in a month, I was driving down to go see him and stuff, and stay overnight, and I got to meet my nephew,
Wow. Awesome.
and it got introduced, and he introduced me to my nephew as Amy.
Wow.
So that was awesome.
Wow.
I thought that relationship was
Wow.
going to be super. And then I got married, and I wanted to bring my spouse to introduce my spouse to my brother, and he's like, "Well, I don't have anything against you, but I don't really want all that extra stuff,
Mm, sure.
around
Yeah.
down here and everything." So I was like, "Great, I'm just going to cut off all contact at that point."
Yeah, well, that's your choice.
Accept my spouse or don't accept me either. I
Of
mean,
course. I agree with you. I
and
agree.
then I
Yeah.
got one other brother that's just 7 years younger than me, and I haven't heard from him since my mom's funeral. And
Oh.
my dad was actually a cross-dresser, but
Wow.
he was so old, born I think like 40, 41 or 42,
Yeah.
and so he was so old that he just wasn't capable of comprehending the difference between a cross-dresser and a transsexual
Of
and a
course.
female and all that stuff. And
Yeah.
so, and in his eyes, he never told me I couldn't come visit. And he just, in his eyes, he couldn't quite understand why I couldn't just, do it in private.
Of
And,
course. Yeah, of course. Yeah.
and, but I still
How
felt
did
love
you
for
find
him.
out he was a crossdresser? Did he tell you that, or
Um,
did you find
yeah,
stuff?
I discovered it, and my mom told me as well.
Wow.
And
Wow.
because then we get into my mom's view of everything, and I tried just being a crossdresser for many, many, many years,
Sure.
and eventually cross-dressing became the thing that was causing the depression because I
Oh.
didn't even want to cross-dress anymore because
Oh.
I would have to uncross-dress the
Yes.
next day, and
Yeah.
so it was either go full time or suicide, and I phrased it that
Yeah.
way to my mom. My mom told me I made the wrong choice.
Well, I mean,
She thought I should have chosen suicide.
people just, that's why I always say, when I said earlier, whatever your judgment is going to be on Amy, you'll never understand the life and the way it is to live. And, like how nobody should be okay with anybody killing themselves. So I don't care what
Yeah,
you believe in the
yeah.
lifestyle or
She
whatever. That's
actually,
just not, I think a lot of times parents get embarrassed of things and then they, maybe it's about her. That's why she said it. It was
mhm.
about her. It wasn't about you. It was about her and her feelings and maybe her embarrassment of you or something.
Yeah, and the
Right.
real ironic thing is that when I look in the mirror, I look almost identical to the way my mom looks at this age.
Wow, that's
It
so
is so
crazy.
freaky.
Yeah, I mean, it's sad that, parents and family members can't seem to, but again,
Yeah.
I think the best way to get around all that is to realize it's not you, it's them and their stuff.
Hmm.
And I have a sister who doesn't want to deal with it either. And that's all right. I have no issues with that. Like, I would never push myself. You just have to move on like you did. Your brother didn't accept your partner. So you were like, okay, well, then I'm not coming either. And
Yeah.
that's how that works,
Yeah.
really.
I got a whole trans family here in Houston.
That's right.
And
That's right. 100%.
me and my spouse, we moved into this brand new house here in January. Got married on
Yeah.
January 10th as well.
Great. Congratulations.
And we reached out to the trans community, like, does anybody got a spare this or spare that?
Uh huh.
Our house has pretty much been other than the appliances which it came with,
Yeah.
um, all the rest of the furniture in the house that we didn't buy ourselves for like 20 or
Wow.
$30 has came
Sure.
from the trans community.
That's real community. That's because they
Yeah,
care about you. Too bad
they've
it's
all been
not all.
super great.
Yeah, that's awesome. I'm happy that you're around all that, especially
Yeah.
dealing with your cancer and that
Hmm.
horrifying surgery situation. I'm so happy you came out of it, though. You actually came out of
Yeah,
that.
me
That
too.
surgery could have actually killed you. It seems like.
Yeah, yeah. If I hadn't like, let's say, like, if I didn't feel good enough to go get that first follow up after my sex surgery, how many days would have laid there in my bed at home before
That's
I finally
right.
felt enough pain to go to the
That's
ER
right.
maybe or
That's
something? And
right. So if you were to
um,
have to say, I have a friend. She comes on my channel every once in a while. Her name is Tori. She just had a bottom surgery and she's very happy with it, and it seemed to work out fine for her. But I'm wondering if you, since you had such a other complete opposite experience with it, what would you say to maybe a young transgender woman who wanted to get this particular surgery? I mean, would you steer her away from this particular one and into a different one, or would you just
definitely away from
caution?
that doctor for sure. Um,
Right on.
and I would, you know, I, I would tell that person what happened to me.
Yeah.
That you can have,
Yeah.
you know, the worst case scenario happen,
Yeah.
and um, you're not going to be recovered in just, a few months. Let's say dilate for 6 months before you have sex. But
Yeah.
no, you may not ever get to have sex ever afterwards. If it goes badly, decide right now before you even have the surgery, are you going to be okay never having sex in your life ever again?
Yeah. That's great. That's great.
And
You say
fortunately, at
that.
least I don't have much of a sex drive.
Yeah.
But that could be right
Yeah.
now because of all the meds I'm on. Who knows? Because right now I'm on 30 milligrams of morphine for the cancer 3 times a day,
Wow.
and a fentanyl patch, and
And
gabapentin,
fentanyl.
and gabapentin, and methocarbamol, and Tylenol.
Is that all for pain?
That's all pain management. Uh,
My God.
Now, fortunately, I've been able to, because I've the first surgery I had to have related to the cancer, because it spread from the kidney to my spine, and
Wow.
it's on the L3 vertebrae,
Oh my
and
God.
um, that was eating into the spinal cord itself, and it was
Mm.
hitting on that, and it's eating into that sciatic nerve.
Mm.
And I don't know if you've ever had sciatica pain.
Yes, I have.
Yeah, it's like your whole leg is on fire, and
Yeah,
you
you want to
can't do
die.
anything about it because the fire's on the inside of the leg, and you can't do
That's
anything
right.
to it.
Yep. Yep.
And I had to, I didn't get the surgery for that until February this year, even though I was
Oh,
diagnosed with it
wow.
November last year. I was keeping myself high on my mind with gummies and every other, because we get CBD gummies here, and that's
Do
about
you
all we
take?
get.
Oh, yeah, you
And I
can't
was
do it.
taking that and all the gabapentin and everything else, and I was just trying to stay as much out of my mind as I could,
Wow.
and until I could get
Wow.
the surgery, and I would still have to go get um, MRIs and CTs in the meantime, and they were
But
trying to
what
linger
was
me.
taking them so long to give you the surgery? It was just
It was
backed
the
up, or
holidays. It was the
oh, the
holidays, and nobody wanted to do
holidays.
anything because of the holidays.
Oh, so you had to
You would
deal
think
with
it would be
pain.
emergency surgery, but I guess they didn't think
Especially
so.
when you're in chronic pain like that. That is
Hmm.
actually drives people
Hmm.
actually mad. It does. It drives people mad.
Yeah,
It does.
and just to put another trigger warning on here for anybody. related to arms. I do have a pistol here in the house.
Oh,
I've thought sometimes, but then I've also
yeah.
thought to myself, there's still movies coming out I want to watch.
Yeah. Well, yeah. I hear you,
And
friend.
so yeah,
Please
I got a
don't.
real morbid sense of I do really
I
have
do
a
too,
dark morbid
actually.
sense of humor.
I do too.
I tell myself that for Christmas last year I got a house, a spouse, and a 3 to 5 year death sentence.
Oh my God. Wow. I
God.
know. It just seems like, God, you just have had like crazy situation happen to you, one thing after another since
Mhm.
that surgery. But before we go here, I just want to ask, are you happy?
Yeah, I am overall happy. Especially since I got married and
Yeah.
we were dating,
Yeah.
before I got diagnosed and even
Sure.
after I got diagnosed. We had talked about marriage at some point,
Hmm.
and when I got the diagnosis and stuff, I was like, well, we definitely don't need to get married. I wouldn't put anybody through that.
Sure.
And they told me to stop saying such dumbass things.
Good for them.
And they have
Because you never know.
been,
I mean, they're giving you a three to
she's
five.
been my
That's,
rock. And
yeah, that's
she's
awesome.
also male to female trans. But
Okay.
she's just kind of just getting started in it. She's not quite
Sure.
living full time yet. She kind of does
Sure.
some days. Some days she'll go out with me, you know, in fem mode, for lack of a better way of phrasing it.
Sure.
Because she's trying to get up that nerve, and her breasts are going to about a B cup so far is all. So right now
Well,
it's
it's
all about
good.
she's trying to buy some more fashion and build up her wardrobe and stuff like
Well,
that.
it's good she has somebody like you to sort of
Yeah.
lean on each other and,
Hmm.
find that space to do what she needs to do for
Yeah.
herself. Yeah, I think, well, I think most importantly is that you're happy and you get to be the woman that you wanted to be in some level. I'm just so
Yeah.
mad about the surgery for you. That just, I feel very upset about these surgeries and that we just sort of don't, in our own community, don't really put it out there that, they're still on some level experimental. They're not 100%,
Yeah.
like great. And complications happen seriously. Almost, God, it's great. It's from my own observation, I see it worse complications for the females to males in making the penis. I see there's
Yeah,
just
because they
way
have to
more.
create a
That's
urethra,
right.
and
That's right.
on mine, all they had to do was cut some of the length off the urethra, which you would think
That's
that would
right.
be a good donor source of
Yes.
urethra material.
Yes.
Like, hey, I'm gonna have it, like,
Yes. Yes.
just get, if you can get live donor tissue, like a live living donor organ,
Yes.
from a piece of your liver that you give and stuff like that. You would think if you could find somebody that you could get, or maybe use the cadaver tissue
Maybe.
of a urethra. I don't know what they use really. So,
I think it's dead already, so they can't. But it's just,
mm,
I don't have that surgery. I've been living like this for 33 years. I just tell you that I haven't missed out on anything by not having it, and I have a
mm,
wonderful sex life. I have a wonderful life, and it's why I talk about it all the time because I don't particularly
mm,
think I know people's dysphoria, especially females who need a penis. I get it. I get the dysphoria. I had it, but there's some things that we transsexuals just can never have, and I think you know again just trying to find that space and to live life as much as you can without having to go through all this insanity. I mean, you literally wanted to jump out the window,
yeah,
which is
yeah.
horrible.
One of the other things that took me so long to progress with my transition was that when I was still so overweight, I just figured I was never going to lose the weight. So I just kind of had to get my mind on board with the fact that I was probably never going to have any kind of gender surgeries
Yeah,
because I never thought
that's
I was
right.
going to lose weight. And
Sure.
and uh, so what I was doing instead was it was just doing things to just make my life comfortable as it was. I was
Yeah.
living in a comfortable life financially. I had all the
Yeah.
I had TV games. I was living inside World of Warcraft. and living
Sure.
inside of EverQuest, playing all
Right.
female characters.
Yes.
That was such a big dysphoria relief, was to be able to just create a female character in a game.
Well,
Start
a
there.
lot of trans people are into gaming, and I think for that,
Yeah,
especially the youth, a lot of these young people are really
yeah,
into it because I think you said it right there. It's a fantasy land. They can get out of their living in the world of out here and dysphoria,
hmm
but there could be bad things from that, especially for young
hmm
kids. I think that we're starting
yeah,
to see. Um, well, thank you so much, Aimee, for the awesome conversation and reaching out to me. And I think that please leave her beautiful comments and um, questions. And, maybe I can have her back on to answer questions if you guys
yeah,
have any for
yeah.
her.
I'd love to be back on. Yeah,
Yeah, that would be fantastic. And I do appreciate your time a lot, my friend. So thanks for reaching out. Thanks everybody for watching. And again, subscribing to the channel helps a lot, and comments and liking this video and maybe getting it to someone who's thinking about going through the surgery. And that, I always want to show all sides to these situations. Tori had a great surgery. Aimee didn't have a great surgery. So these are the kind of balances we need to have the conversation with. So I'll see you guys all on the next one. Have a great, awesome, beautiful day. And thanks again for joining us today.